those inches off your body in less than an hour. Sounds like a bad infomercial.
Ah, Rosanna, but what we're talking about is a real medical procedure, power liposuction. Drop the fat without the pain and long recovery time.
All right, take a look at Kim. She looks good, right? But like most of us, when she looks in the mirror, she sees trouble spots like her thighs.
Her solution, Power Lipo, and she's taking Fox 5's Dr. Steve Salvatore and our cameras along with her for the surgery.
We're here at the Juva Skin and Laser Center. We're about to start a procedure called Power Liposuction. Now, Kim is here to get the liposuction before her surgery. She's about to get married in January. So tell me, are you nervous?
A little nervous, but not too much.
What made you have liposuction surgery? I mean, you're clearly not fat. So what is it with you, really? Tell the truth.
Well, I've always worked out. I've always eaten healthy, taken care of myself. But you have that one problem area that no matter what you do, you can't get rid of. So it seemed like a good time to do it.
What does your fiance think about it? Did he encourage you, or did he think you were nuts?
Of course, he said I didn't need it, but he's totally supportive with me doing it.
Well, sounds like a good man telling you don't need it at this stage. Over here, this is Dr. Bruce Katz. He's the surgeon performing the procedure today. Bruce, tell me, what are we about to do here?
Well, what we're going to do is perform power liposuction. Kim has small little puffs of fat on the sides of her thighs, and we're going to just remove them and flatten her area there.
Okay, we're about to get started here. We're just getting into the anesthesia phase of the procedure. Now, right now, Dr. Katz is injecting anesthesia with an instrument under the skin, so the skin fills up with the anesthetic and Kim will feel less pain. Bruce, tell me exactly what you're doing here.
We are injecting what is called tumescent anesthesia, and this will completely numb the area so that Kim won't feel anything during the power liposuction procedure. And this fluid just constricts the blood vessels, numbs the area so that there's very little bleeding, as well as having complete anesthesia.
Now, before we went and started doing this, Kim got some medication beforehand to kind of help with the pain and keep her calm, correct?
Right. This is the only really sensitive part of the procedure, so we gave her some medicine just to numb the feeling and allow her to relax so she doesn't feel very much.
All right, let me check in with Kim here. Kim, now Dr. Katz says that this isn't so bad. What do you think? Tell me.
I can't say it's so bad. It's a little uncomfortable. There's like a lot of pressure and a few little pinches, but it's not unbearable.
So far you're thinking this was a good decision?
Yeah, absolutely.
All right, we're going to check in with you later. I don't want to bother you, okay? All right, we'll come back to you guys in a few minutes. We're going to start the liposuction procedure in a few minutes. As soon as this side is anesthetized, Dr. Katz is going to get going. Back to you in the studio.
Ooh, all right, she's a brave woman. Can you believe she's letting us in the OR for all to see? Everything.
I know, and we'll actually watch her body take on a whole new shape.
You've seen surgeries before, but nothing like this. She's awake for the whole thing and talking to our Dr. Steve the entire time.
So what exactly does it feel like to have the fat sucked right out of your thighs?
This isn't so bad. What do you think? Tell me.
Wait and hear her answer and watch it happen moment to moment from beginning to end.
In the time it takes us to do this hour newscast, her surgery will be done and she'll have a whole new body. See it next.
We have taken you inside the operating room for Power Lipo.
When we last saw Kim, she was about to change her body forever, all in under an hour.
Let's check in with our Dr. Steve Salvatore to see how she's doing.
We're back at the Juva Skin and Laser Center with Kim. Kim just had the anesthesia put into both legs, both sides of her thighs, and she's about to have the procedure done. Kim, tell me, how do you feel?
I feel quite relaxed. I'm not too nervous now. That was the worst part, I think, so this should be good. Should be easy.
The rest from this part is supposed to be no problem at all. So we're going to be with you the whole time. We'll see how you do. I'm going to go over to Dr. Katz and check it out, okay?
Okay.
Now, Bruce, tell me what are we about to do here?
Well, this is actually the power cannula. This is the tube that we put under the skin, and we suction out the fat here, and this moves back and forth very rapidly at about 3,000 strokes per minute. The fat goes through the tube, into this bigger tube, and then into the aspirator or the vacuum. This tubing allows us to be extremely precise. Instead of doing this manually with a hollow tube, the machine does the work for us. So it's much less traumatic to the tissues. It allows for much faster healing. People get back to work 2 days after the procedure, and we get better results cosmetically.
How long will it take you to do an area about this size?
Probably about 15 or 20 minutes, and then we go to the other side. So it takes actually for the procedure itself maybe half an hour.
All right, we're not going to get in your way. We're going to let you get going.
You feeling anything?
I just vibration. Okay. So I just want to know what I'm supposed to feel.
You'll feel vibration. It'll feel like a massage from inside, basically. If you have any discomfort, we will we'll put more anesthesia in. So just let us know. But this is really considered the easy part. Now you can see, Steve, as the fat's coming out, there's no blood. So we insert the cannula here. And Kim doesn't feel this. And it goes back very slowly, back and forth. And I can know exactly how much fat I'm removing in just one direction, because I know where that tip of the cannula is. So I'm only removing fat in that area.
Now, traditional liposuction, we're used to seeing really a jerking, jarring, a pushing back and forth. We're not seeing any of this here. I mean, this is really smooth.
Yes, and this is why power liposuction has become such an advance for the procedure. It's much less traumatic, it's easier for the surgeon. You know, when I used to do traditional liposuction, I'd be perspiring by the end of the procedure because it's a lot of work. The patient is bouncing around. Most of our patients describe this as massage.
Well, let's see if Kim thinks it's a massage. Kim, we're going to check in with you. How you doing there? Does this, what would you say, does it feel a little bit like a massage under the skin?
That is what it feels like. I mean, you know, I wouldn't want to just like do this just to get a massage, but it's not too bad at all. It just feels like a vibration under the skin.
Kim, so do it slowly.
Dr. Katz has just finished both sides of Kim's liposuction. She's going to get up now. Now, like we said before, she was awake. She had only local anesthesia, so she's not sedated, sleepy, or woozy. She's going to stand up and take a look at the results. Bruce, tell me, how did the procedure go?
It went extremely well. It took us about 15 minutes on each side, and we have Kim stand up now so we can make sure everything is even. The reason we also get better results is that when a person stands up, gravity actually affects their contours, so we can see how they're going to look in the natural position, which is standing.
All right, Kim, ready?
Yes.
Okay, see how it goes.
Now, if you feel dizzy at all, just,
Slovic.
that's good. If you feel dizzy at all, just let us know. We don't want you to fall down. Let's see now. There's a little puff right over here. So I didn't see that while she was lying down, but when she stands, it becomes apparent. So now I'll go back here and just take a little bit more right from here. Everything else looks, well, I can do a little bit more here too. How are you feeling, Kim?
Okay.
Good. Now turn towards Deborah. Deborah will support you. See how nice and smooth that is now?
Yep.
Perfect contour. That looks great. This puff is still larger than the surrounding area, so I just finished this off. Kim is perfectly comfortable.
All right, so Kim, how are you feeling now at this point?
I feel good. Really good. Doesn't hurt at all.
You look great. I mean, it's like it's not even happening. You're standing here looking at me like we're just talking.
Yeah, I mean, I'm glad it's over now, almost, but it wasn't painful at all.
And I'm just going to take a photo quickly so you'll be able to see.
Kim, what do you think? This is a side shot of your thigh. What do you think?
It looks smoother. I mean, it looks bigger only from the swelling, but the skin itself looks smoother.
You think it was a good choice here,
Yes,
the way it came
absolutely.
out?
Absolutely.
Would you recommend it to your friends?
Yes, in a heartbeat.
Okay, great. We'll throw it back to you guys in studio. We're finished with the power liposuction procedure. Different from liposuction. Remember, power liposuction. Liposuction in less than an hour. Back to you.
Wow, now here's the thing I wanted to know. Here's the catch. The surgery costs between $3,000 and $7,000 depending on what you have done.
I don't know. I'm going to live with my love handles for a while. And of course, you know, there are risks. Make sure you talk to your doctor
Now, after the
first.
swelling goes down, we'll get a better idea how Kim looks. And of course, we will check back with her and show you the results.